valgus surgery, bunions, a lot of operations, but this is one that I found useful for just about all levels of deformity. Lumps on the hand can be from a variety of causes. Look carefully here. What do you think this is? Hip problems. We're the old chestnuts. We're the experts on the hip. How would you manage these problems? Read carefully. Knee arthroscopy, this is our bread and butter operation. This shows a very simple technique of setup and how to perform it without the need for assistance. Read it carefully. Note the use of my own legs and holding and steadying the leg during the performance of the knee scope. Repair of a ruptured lower end of the biceps using a bone anchor to the bicipital tuberosity. It used to be an operation that failed a lot, but this is a much better technique. One day in the life of organizing your OR day. Just read a few principles, how to set it up properly. It's a big day of the week. If you have 1 or 2 operating days, you need to have it properly organized for yourself. Pediatric cases are actually very hard. Just read some of my comments here, you may find it useful. Surgery of the rotator cuff is very satisfying and get good results. However, you have to set up as critical. Look at some of the things I've found over the years. Please read carefully. Hope you find this useful. The scaphoid, we call it the sorceress. It's a difficult bone to deal with because of the precarious anatomy, and especially the blood supply of this bone. Have a look through these cases, see how you would manage them. Hope you find this useful. Surgical scrub kit techniques. We seem to have forgotten the basics. Here's some things that I found very useful. Especially the use of alcohol to supplement soap. Fractures of the humeral shaft. Here's a technique I found useful, using rush pins. That's right, rush pins. It's an old technique, very simple, very useful, cheap implant, and very effective. Here's another case, osteoarthritis of the shoulder. How would you manage that? Spinal problems. They can be boring with so many back pain patients turning up and have you ever wondered why spinal surgeons are so unhappy? But you have to be on the lookout. Sometimes important things turn up. You must not miss them. Have a look at these cases. Arthroscopic subacromial decompression of the shoulder, an important operation. It's easy to do and it's quite an effective operation. You just need to have the right setup. Have a look at my pictures here, they may be helpful in your practice. Trigger thumb, a little operation for you but a big one for the patient. Do it carefully. Look out for some of my surgical hints illustrated here. Your OR workstation. You like operating, so set up your workstation properly. Here's some hints that I've outlined here that you may find useful. In conclusion, thanks for looking at these golden pearls in terms of operations and surgical techniques. I've found them useful over the years and I hope you do too. Best of luck.